Jennifer. I'm going to be your nurse for today. Is this okay if I just put my laptop down? Okay, I have all of your doctor's orders on here, so I wanted to bring it with me. And I am just going to clean my hands. And can I have your name and date of birth? Okay, great. And I'm just going to check your ID band. Ellen Davis, 9/19/1954. Let me just check that against your chart. Okay, perfect. And I have the same thing. And I see you have no drug allergies, but you have an allergy to pollen. Okay, which is going to be fine for what the doctor ordered today. Okay, so Mrs. Davis, what we're going to do today is I'm going to give you some hydration through your IV site. And we're going to start, it's going to be a two-step process. So we're going to start with regular fluids. It's called sodium chloride, so it's got a little bit of salt in there to keep you hydrated. And I'm going to come back after that is infusing for a little bit and give you an antibiotic, which I will explain to you in detail. How does that sound? You're okay? All right, perfect. Professor, for this part, I just want to show you what I have because I'm going to clear this table so I have some room. So I have my sharps container, which I'm going to just kind of move out the way. I have a box of gloves, hand sanitizer. I have paper tape if needed. I have a Tegaderm, which I already secured to the patient. And I don't know if you could see from there, but I follow the steps of the video, so I should have everything okay. And this is a receptacle to catch the fluids. So I'm going to leave that there. I have 500 mLs of sodium chloride, and then I have 50 mLs of what is going to be our cefazolin. So I'm going to move these over. And then I have my IV administration set and my secondary IV set to do the next video, and alcohol swabs. These are open because I was practicing, so we're going to pretend that they're sterile, and I'll leave them here so that'll be prepared. Okay, back to the video. Okay, Mrs. Davis, I'm just going to check your doctor, his orders, so I could see exactly what he ordered to make sure I have the right medications with me. Excuse me for one moment. And Professor, I'm just going to bring this over. I don't know if it's going to show backwards on the video, but I'll read aloud. Sodium chloride, 500 mLs, 125 mLs per hour intravenous, which I calculated comes out to 20 drops per minute, and that's continuous. Okay, Mrs. Davis, so we have over here sodium chloride, 0.9%, 500 mLs. I did check this against the doctor's order, and this is also my first check. So this is what the doctor ordered. Also, at this time, I want to make sure I have the 5 rates, which would be the right patient, the right drug, the right time, the right dose, and the right route, which is IV. Okay, so this part is done and ready, and I think I'm good to start. So I'm going to put gloves on Mrs. Davis. And are you having any discomfort or pain at your IV site? No, it feels good? Perfect. Should you have any, you just let us know. I'm actually just going to check it. I'm just going to touch lightly. And everything looks really good. No signs and symptoms of infection, and the client denies any pain. So it looks good to me. All right, so at this point, I am going to start. So I'm going to open up my package. I'm actually going to move the secondary IV set, Professor, just out the way for the next video, so I have room. So at the bottom of this IV bag is this blue portion, which I'm going to pull off, and I'm going to pretend I'm opening my alcohol pads. I'm going to swab it with some alcohol. And I'm going to hold all this tubing so it doesn't fall apart all over the place. And there is a spike on the tubing. And I'm also going to just clamp the tubing so it doesn't go through. So I'm going to use the spike and I'm going to just insert it into this IV bag where I pulled off the blue cover. Okay, and it's all the way in there. Perfect. And I'm going to come here and hang this up. Okay. And again, I'm just trying to keep all this tubing sort of in line. Okay. I have my roller clamp here. And right now the roller clamp is open. I'm going to open the other clamp. And I do have a garbage can below me, so I'm going to let my fluids run into that. I do have a cap at the end, which is going to go into the client's port. I'm going to take that off. And we do have the fluid running. And I'm going to just close the clamp and just, I want to fill this area about halfway. So now we know that it is 20 drops per minute is what the doctor ordered. I'm going to open the clamp up just a little bit. And I have a watch with a second hand, and I'm going to count the drops and see if we're at 20 drops per minute. Okay, and we are exactly at that time. Now I'm going to clamp this so we don't waste any of it. Okay, the IV has already been flushed. I'm going to use an alcohol swab. Again, just pretending that I'm opening my alcohol. I'm going to swab Mrs. Davis's port. Okay, Mrs. Davis, you're not going to feel any discomfort here. I'm just cleansing the port. And I'm going to cleanse the other end of the IV line just because it was open and we don't want to introduce any bacteria into Mrs. Davis. And I'm going to just push through, and it's a Luer lock, so I'm going to screw that on. And I just want to make sure that there are no air bubbles. And we actually lucked out that there is not much. There is one here. I'm just going to tap it. Okay, and it went into the chamber. Perfect. And actually one more. Okay, great. So if there were any other air bubbles, we would do the same as try to just tap it, get the air up into the chamber. So now we are all set up to go. I am going to come here and I'm going to unclamp this. We have our drops per minute already set and it's going well. So at this point, I would wait a few minutes. So let's pretend a few minutes passed. Mrs. Davis, how are you feeling? You don't feel anything. Okay, great. So this should infuse and I'll be back in about 30 minutes and then we'll start your medication. All right? Okay. So I'm just going to clean up all my garbage. And just sanitize my hands once again. At this point, Professor, I would go into DocuCare and I would document everything that I started the IV as the doctor ordered, her infusion. So I would document all of that and leave the room. All right, Mrs. Davis, is there anything I could do for you before I leave? You're okay? And don't forget, you have your call bell. Should you need anything, please don't hesitate to contact us. All right, I will see you in a little bit. Bye.